Wel, welkom terug Eden en weer luisteraars. En ek love onze jingle fight song. Dit laat my altyd in 'n goeie bys kom. Vanaand sit ons weer hier so met ons het koppe bymekaar. Vanaand is dit net ek en Ronel. En ons en Hans is op 'n ander uitstapie. Ons mis hom vanaand. En ons het natuurlik weer 'n baie interessante gas vanaand hier in die ateljee. Ronel, goeienaand, kan jy ons hoor? Ronel sit daar in die Kaap en sy sukkel so 'n bietjie met haar internet, so sodra Ronel kan inskakel, dan is ek seker luisteraars sal sy vir julle groet. Nou, ons gas vanaand is Shannon Jentsel. Goeienaand, Shannon.
Good evening, Priya. Thank you for having me.
En Shannon het 'n baie interessante verhaal. Sy is gebore in die Kaap en is toe van die Kaap af is sy 'n bietjie Mpumalanga toe.
Net so, ja.
En van Mpumalanga af is sy terug Mosselbaai toe. So ek hoop al die Mosselbaai mense luister vanaand en jy kan later vir hulle 'n shout-out gee. Maar op die oomblik is Shannon hier in Oudtshoorn. En sy is 'n mediese dokter. Sy het by die Universiteit van Stellenbosch, ek het van vroeër gesê, ek en sy is outomaties. So sy het by die Universiteit van Stellenbosch het sy gekwalifiseer as 'n mediese dokter. En jy doen nou jou internskap?
My community service.
You do your community service
yes. At HCSC in Oudtshoorn.
Yes, and HCSC stands for
Health Center South Coast.
Yes, for the Army.
Yes, for the military. For the military.
I hope she left all the guns and bombs at home.
I'm unarmed, Stephen. I'm unarmed.
So Shannon, can you tell the listeners a little bit about yourself?
So I am Shannon Jentsel. I'm 28 years old. A medical doctor, something I've always wanted to be. I am one of two siblings. I have an older sister, Chanel. She's married to my wonderful brother-in-law, Byron, and they have a nephew named Seth, who is the love of our lives. My parents are still in Muscle Bay, John and Beverly, or Mommy and Dida, as I call them. I'm unmarried, no kiddies yet, but I do believe that there's someone for everyone. So at the right time, at the moment, I'm just living out my passion, which is to serve the community. Primary care medicine is my favorite. It's something I've always enjoyed, and that's what I'm doing here in Oudtshoorn at the moment. Here to serve.
Welcome to Oudtshoorn.
Thank you, Priya. Thank you.
So, Shannon, before we started, you actually told me a very interesting story on why you decided to become a medical doctor. Would you like to share that?
I would like to share if the listeners won't mind. As I said, I was born in Tygerberg Hospital. I was born prematurely. And the doctors had mentioned to my parents that there's a 50-50 chance between my mom and myself for who would be saved. And the way that it was done back in the day was the mom would always get preference between the mom and the baby. And my dad was at Sasol at the time, so he was in Johannesburg, and he had taken an emergency flight to come to Cape Town. And my mom was sent in for an op. And by the grace of God, we both were saved. 28 years later, we are still here. And I just had a love for medicine, I think, since that day. From what I can recall, I think I was 3 or 4 years old. I remember walking into a doctor's surgery with my mom, and just the smell of medicine and surgical spirits and everything, it just enticed me, and I loved it. And I knew that is what I wanted to do. At that age, I didn't know what it entailed. I didn't know the long years of studying
and the long
hours and the weekends you'd have to spend behind the books. But I never saw myself doing anything else. And chose the subjects in high school to pursue that career, and we went to Stellenbosch, and now we're here.
Amazing. So I see, Ronel, you are here. Welcome.
Thank you, Thea. I had a bit of technical problems this side, but I'm here now. Glad to be with you guys.
Glad that you are here. And I've just introduced Shannon to our listeners. So Shannon, tell me, what last year you were doing your
internship.
Your internship. So most people don't know that you complete your degree in medicine and then you do an internship.
2 years internship.
2 years internship.
And 1 year community service.
And 1 year community service.
Before you can practice independently.
Yeah. So your internship, what was your internship like being plunged into a pandemic like Corona?
So internship in general is quite difficult. It's 24 months of training in different fields of medicine. And towards the end of my internship was when this global pandemic had started. And we were all told we were going to be on the front lines and we were prepared for it, but in a way unprepared because we'd never dealt with something like this before. But we had great mentors, we had great teachers, and the hospital which I had done my internship at was very well prepared, I think, for the pandemic.
And where was this?
That was Mitchell's Plain District Hospital.
Mitchell's Plain District Hospital. I've heard a lot of good things about Mitchell's Plain.
It's a very good hospital. Yes, they serve a very large population, an amazing group of doctors and nurses, and a multidisciplinary team that is working at that hospital. So the pandemic hit the Western Cape at about March. And that is when we started seeing our first COVID patients coming in. Luckily, there'd been a plan implemented. We worked in groups, we took shifts, and we tackled it, I think, one case at a time as best we could. Obviously, there was fear initially because this was an unknown, it was a new virus, and we were all scared. We didn't know who was going to get it, what were the effects going to be, and there was no vaccine at the time. And there was also no treatment for it at the time. But I think the most important thing was that we worked as a team. And everybody brought their part and everybody did what was expected of them. So when the one grew tired, the other one could step in, and that was most important. Because we didn't know a year ago that we'd still be sitting in this pandemic today.
Yes.
So I think teamwork was most important to get us through the initial phases, especially during the level 5 lockdown. We had to travel with permits to work. We were being, pulled over every day. You were being inspected. You were being monitored with temperatures and things like that. And we were obviously approaching flu season as well. And you would think that the slightest cough or the slightest tickle in your throat, you'd be concerned it was COVID-19. But some of us were, I think, I wouldn't say lucky enough, but some of us had succumbed to the virus and some of us had not. And all of us just helped each other power through, I think, as a team. Yeah.
And I'm wondering, Shannon, because you didn't just work at Mitchell's Plain Hospital. Earlier on you told me you did some outreaches also.
Yes, we did. So I did my student internship at Tygerberg Hospital.
Yes.
Which serves a very, very large population. And then during that internship, we had done outreach programs in the Transkei, in the Northern Cape as well, primarily primary care medicine outreach programs. We would go into the community and do some community work and just primary care medicine, so hands on the ground, working one-on-one with your patients, which I absolutely
with limited resources.
With very limited resources. So yes, it's something that they call rural medicine.
Yes.
It's becoming a specialty on its own, but it's learning to work with very little to nothing resources and just making the best out of it.
Yes.
Yeah.
And coming back then from having worked in a rural setting or doing rural medicine, and you were telling me that you were in the Transkei as well, where you were exposed to no electricity.
Sometimes no running water, but still I think it's just the spirit of wanting to help.
Yeah.
So if there were power outages, if there were load shedding, generators would kick in. We were just lucky enough that there was always someone shining a light, or there was always just somebody willing to help. And it was literally working with little to nothing, but appreciating what you had. Still making it stretch, making it last for the next patient, learning ways to kind of, I think, use the little that you've got and just multiply it so that everybody could receive a service.
And so that actually, in a way, prepared you for the pandemic.
Yes, it did. Yes, it did. Because we were obviously worried about the shortages of PPE.
Yes.
That was a big problem in the beginning, but we knew then how to ration and just how to make things last so that there would be enough to go around for everybody and that it would last a long time as well.
Yeah. And your parents, I'm just thinking, here you are,
Yes.
almost newly qualified doctor, and you are being exposed to a pandemic. You are in the front line. How did that go down with your parents? You are there in Cape Town, in Mitchell's Plain of all places, and they here in Mossel Bay.
Yes, so I was privileged enough to have my mom with me in Cape Town for most of my internship, due to the fact that my nephew was born.
Okay.
So it was the first grandson and the first nephew on our side of the family. So my mom was there as a major support system throughout this whole pandemic. And a big part of, I think, getting up and going to work every day was knowing that for me, I had a very strong faith, I still do, and knowing that we still had the protection of a higher power, and knowing that the Lord was with us and covering us and just guiding us through, because there was a lot of unknowns. But then I had praying parents as well, my dad from Mossel Bay and my grandmother, my siblings, my aunties, and friends as well, a very good support system that just, I think, on those days where you felt you can't get up, you can't do this, there's so many people dying around, there's so many people sick around you, just having that WhatsApp come through or that phone call that you can get through this, you can, there's people counting on you, there's people supporting you, that played a major role. So I think having my support system in Cape Town, but knowing that they just, hulle is net oor die berg, as ons Mosselbaai toe moes gery het, that helped a lot. Yes, it helped a lot.
So I'm wondering on a personal level, because I know I spoke to a lot of medical staff, especially nursing staff, when coronavirus started, and some of them felt that, listen, I never signed up for a pandemic.
Yes.
To some degree, I knew what I was signing up, but not a pandemic. Yes, I'm here to serve, but everybody was just so ill-equipped in terms of all of us, right?
All of us, yes.
How did you feel thinking that, listen, when I signed up to become a doctor, I didn't sign up for a pandemic right about now?
The fear was there because we'd obviously all taken an oath on graduation to place our patients first and the well-being of our patients and to provide care. But now we're providing care at the cost of our own well-being.
Yes.
And it just came down, I think, to almost a spirit of, if we can protect each other, we'll be okay. And if we can protect the community, then surely things will work out at the end. But there were days of doubt when it was like I did not sign up for this, or this was not in my oath.
Yes.
To put, I think, my life on the line. But then again, you think of that patient being your mom or your sister or your gran or somebody that you know, and the face becomes someone that you know, and you spend so much time with them, you form a bond with them, and they are the only person that you see. They are the only hand that you can hold, albeit wearing a glove. They were the only contact that you were the only contact that they could have for a very long time, and you kind of become family. You become close to those people. They become a part of you. So you do it for them, and you do it as providing a service.
So, Eden FM listeners, we are speaking to Shannon Jentsel from Mossel Bay, and she's a medical doctor. She's doing some community service here in Oudtshoorn, and we're going to come back and we're going to talk a little bit more about her experience as a newly qualified doctor with the coronavirus and the prospects that she thinks will be happening with the coronavirus. But now we're going to listen to a song called "The Blessing" by Elevation Worship, and this is her playlist tonight. Hope you enjoy it. See you after the music. Welkom terug, Eden FM luisteraars. Ons het vanaand natuurlijk hier in die atelier Shannon Jentsel van, en sy sê sy's proudly a Mossel Bay Bayer. Yes. Sy wil niks anders wees behalwe dit nie. But we'll see after she stays for the year if she will stay in Oudtshoorn. They say Oudtshoorn's water is addictive. So, now I know that you said you wanted to ask Shannon something.
Yes, Shannon, it was so interesting when you spoke about your time in the Transkei and all the challenges there and how people stood together and helped each other, you know, with little resources. And the thought came to my mind that often there must have been also very shortage of medical resources as well, perhaps. But what I've heard for a few years already from medical interns is that often, already a few years ago, with limited resources, they already had to make very difficult decisions, you know, who to give the last oxygen to, or should they have to choose between patients. And my heart always breaks when I hear that. So in a sense, that's also maybe a preparation for the really difficult situation with COVID, because I understand that that's also something that medical doctors have to deal with.
Thankfully, we never work alone. We are always part of a team, even in the rural, far-reaching hospitals. There's always a senior medical officer or a family physician, a consultant that we can liaise with and then make that decision. It's never an easy decision to have to choose between one patient or the other when both are deserving of treatment. And if there's only treatment that we can provide for one, there are various factors that we have to look at. There's often, I would call it a checklist that has been put together by an ethics committee. Usually each hospital would have such a committee, and then each province would have such a committee. And that list would then help us almost determine which patient has the better chance of recovery and which patient would respond better to medical treatment. And thankfully, that decision is never made by one person alone. It's always made together in a team, and everybody has to agree on that decision, deciding which patient would be for further management and which patient we would allow just for the natural processes to take place.
It's a shared responsibility.
It's a shared responsibility, yeah. Yes.
Oh, that's a bit easier. Yeah.
It's still a difficult decision, but it's often it's often a multidisciplinary team approach. So we'd have a psychologist there, we would have the physiotherapist, the medicine specialists with. So it would be a multidisciplinary team decision.
Yeah, thank you.
No problem.
And talking about making collective decisions, I was wondering, because now you've had the experience of working in a government hospital,
yes,
and now you're in the military setup. Are there differences? I'm sure they won't fire you.
I would hope not. So there are differences. In the government setup, we are much more, actually. We're more hands on deck. In the military, we are a few, but the work still gets done. And there's obviously in the military, there are rankings, and you need to learn all the titles that we can respect each other and address each other appropriately. But at the end of the day, the care that's provided to the patients is still the same. So similar to our COVID patients that we would see, they get tested the same way that we would test them in a government hospital. They get treated the same way. They'll get the same medical treatment, the same physiotherapy if necessary, the same multidisciplinary team approach to their treatment is what they would receive at a military sick bay versus a hospital medical ward.
Yeah, because I think most people, when you think about the military, and especially the medical setup, they are treated more like private type of patients.
Yes, they are, yes.
But yet you say here in Oudtshoorn, when people are COVID positive, they would go over to the public hospital.
Yes, they would. So depending on bed spaces and what's available in the ward, or depending on how our sister hospital is perhaps managing with the trauma cases and such, we would then send our patients over to the district hospital or to the Mediclinic, depending on which one has more space available, and also according to the patient's needs.
So what are your thoughts about the vaccine? Because there's a huge debate going on about to be vaccinated or not.
Sophia, I do believe
that there needs to be an end to every pandemic or every epidemic or every sickness. And over the years, there have been vaccines for various illnesses such as polio and smallpox and TB. We've all been vaccinated through the program from birth up until age 12.
Yes.
So I do believe that if the correct team has been put together and the correct scientists and physicians have come together to help us form a cure or an aid to assist in this illness. And if it is proven that it can be successful in reducing the number of deaths and in reducing the negative effects and the far-reaching effects that COVID is having on our population at the moment, then a vaccine would be the right choice. However, we do respect that every patient and everybody has the right to choose and has the right to accept or not accept the vaccine. So we will not impose the vaccine on anybody. We will not try to persuade a patient to take the vaccine or not. The choice is ultimately theirs. We do, however, know that the health system is under severe pressure at the moment, and we cannot deal with, or we are struggling to deal with, the amount of COVID patients that we are seeing, as well as the normal everyday illnesses.
Yes.
So the normal hypertensive or stroke patients, our normal trauma patients that we are seeing on top of COVID is putting a massive strain on our healthcare workers and on the system itself. So some way something has got to give. And in this instance, it's the light at the end of the tunnel, which is coming through as a vaccine.
And I think the biggest debate is obviously that people say it hasn't been researched enough. There hasn't been a lot of time given to research the vaccine, etc., etc. But when I think back, years back, when we had, what was it, 100 years back? When with the
Spanish flu,
Spanish flu, we didn't have the technology that we have now. So somehow I'm telling myself, shouldn't it be quicker? In any case, because we have the technology.
Due to modern medicine.
Exactly. Due to modern.
I have to agree. I would like to think that together with like the WHO, the World Health Organization, the United Nations, all the pharmaceutical companies, that we are trying to look at the greater good. And we are trying to curb this pandemic from having its devastating effects on the population that it is. And that is through the help of a vaccine.
Yes. And I think, I mean, when we look at the numbers, a lot of people have lost a lot of people that passed away because of COVID.
Because of COVID,
yes. And I'm sure there are also many people that would say, if only the vaccine
came sooner. Yes.
Shannon, I was wondering about the psychological impact that COVID initially had on you personally, and how you managed to get through that.
So I would like to believe that I was a very strong-willed person, that my parents raised me to be free-thinking and independent. But when something like this hits you and it hits close to home, you lose people that you've known, family, friends, loved ones, it's bound to take its toll on you. And I think any psychological issue or problem that you might have had before would kind of just be heightened during this pandemic. So if you were to suffer from anxiety or depression or any sort of mental illness, it would be worsened. Simply because we were cut off from our support systems. We were placed under level 5 restrictions and we were not allowed to visit, we weren't allowed to travel, we weren't allowed to see loved ones. We were isolated in our homes. A lot of us couldn't work for long periods of time, so there was the financial implications of that. And I think for us as healthcare workers, our patients look to us for answers that we didn't have in the beginning. We never had all the research and all the answers that we have now. And we had to kind of put on a brave face. And behind the mask, we, amongst each other, I think we depended a lot on our partners at work to just kind of vent and to just have a safe space, albeit the tea room or just the locker room or the on-call room, where you could kind of just get out of your PPE even and just take off the mask within social distancing, of course, and just cry or just vent, have a moment of silence, light a candle for our colleagues that we lost or our family that we lost. But it definitely did have a major psychological impact. I think all of us kind of took a step back and realized that something like this comes unexpectedly, and it knocks you off your feet.
Yes.
And you kind of realize just how strong you are
Yes.
when you are in the front line and when you have to not just fend for yourself, but for your patients as well,
Yes.
for your family at home, for the community at large.
Yes.
Shannon, it's so interesting to listen to you. Thank you for the way that you explain things. And you seem to be such a bubbly, lively person. It's such a joy to listen to you. I'm wondering, often I would say in a situation of war, people just put one foot in front of the other. There's no time to really stop and think and comprehend what's happening and to regroup, really. You just have to go on. And I think it was like that with the second wave especially. I'm just wondering if it affected you afterwards, that you realize, oh my goodness, we've gone through a difficult time, and that it almost klap jou later in the face, hit you in the face to say, sure, it was really tough. Did you experience?
There definitely was with the first wave. Everybody was, I think we were strong, we were ready to tackle it, we were on the front line. And what helped was that we had the community support as well, and everybody was doing their bit. They were wearing their masks, they were sanitizing hands, they were socially distant from each other. And then it kind of mellowed down, I think, and the fear of COVID, I think, settled amongst the community as well. And then the second wave hit, and it hit us hard because by then we had lost quite a few of our colleagues, and COVID had hit closer to home. You knew more and more people who had been infected with COVID, who had succumbed to COVID, and I think the morale with the second wave was lower. And our fight was a little bit diminished. We had felt almost defeated by the second wave because it felt as if all our efforts from the first wave had just gone by the wayside. And we were seeing an increased number of deaths. We were seeing an increased number of hospitalizations. More and more younger people were being affected by the second wave. And it took, I think, a lot. It took we had to dig much deeper to just kind of push through the second wave. And I think if we look at it now, we're kind of over that peak, and we're seeing a drop in numbers, and we're seeing our recoveries are increasing as well. Our staff members are recovering, but the effect of the second wave was the rug being pulled out from under us. Although we knew other countries globally had experienced it, and we were kind of warned before the time that it would happen, we didn't think that the effect would be as great as what it was, especially in the smaller communities where the resources are much more limited. Basic things like oxygen and CPAP machines we didn't have, and we were lucky enough to be sponsored by NGOs and even by the government itself to just help and assist us through those times that we could get over the second peak.
Are you very cautious about a third wave? Did it change like last year we all relaxed a bit? I don't know if the medical staff relaxed, and then it was almost as a shock, when the second wave hit. Are you a bit cautious? Do you think you're more cautious for a third wave?
I think we are all aware that there is the possibility of a third wave. And therefore, we still urge our patients and the community to still follow the same protocols as if we are in level 5, although we are in level 3 lockdown. The threat is still the same. The virus is still the same, if not stronger. And despite there being some treatment available and a vaccine available, the virus is still as deadly as it was with the first wave, as it was when the pandemic started. So as medical staff, we are more aware of what signs to look for, what symptoms to look for, but we are also, I don't want to say cautious, because we don't know what the future holds for us, and we don't know how this third wave will affect us, not just from a medical aspect, but also just the economy, and also just from a psychological point of view. It's coming in waves, and with each wave, we're kind of getting pushed a little bit back and a little bit deeper into the ocean while we're trying to swim to the shore. And therefore, we absolutely need the community to work with us and not against us. And I think that comes in with false news being spread and fake news being spread. That needs to be addressed. I think if people are unaware of what the truth is, to just ask your healthcare workers, ask your colleagues, what is it about COVID that I don't know? What is it about the treatment that I don't know? And can you educate me, or can you assist me with facts and with the truth? Because it's easier to let somebody believe fake news now in the pandemic than it is for us to tell our patients, no, but this is not true.
Sure.
Please don't follow that. Don't listen to that. We actually want to help you. We are not here to harm you at the end of the day.
So it sounds to me like you're fighting two invisible
Yes,
viruses.
yes.
One is the COVID virus and one is fake news.
That is true. Yes.
So we are listening and we are talking to Shannon Jentsel.
Yes. Jentsel.
Jentsel, sorry, from Muscle Bay. We are trying to convince her to stay here in Oudtshoorn, but we're going to listen to some music. It's Mamela by Mikasa. See you after the music break.
Your favorite community radio, Eden FM, live in the heart of the Garden Route.
You are tuned into your #1 community radio station in the Western Cape and #3 in South Africa. Live from the heart of the Garden Route, Eden FM, your voice in paradise.
Hi, Shannon again. Hello. It's so nice speaking to you. During the break, I was wondering if your perception of treating the dying, I think the medical staff are overwhelmed with all of a sudden there's so many dying people. If your perception have changed at all, or did it affect at all your personal perception about the death and dying? And yeah, if you want to share something about that.
So just as a medical practitioner, we always taught to treat all our patients with dignity. That includes our patients who will have a good outcome and also those who are for palliative management. With that being said, a lot of our COVID patients unfortunately succumbed to the virus, but we often we still make sure that our patients die with dignity, and that you treat the patient as if it were your own family member or if it were your own loved one, and that they are not alone. So we try our best. We try our best to be there, to hold their hand. What a lot of hospitals have been implementing is a video call option, so that they could be there, albeit via a video call, at least to just see their loved one or their family member, because unfortunately, visitors are not allowed into the hospital due to the rapid spread of COVID-19. So visiting hours have been restricted. But with death coming so strongly into our hospitals, we've learned to respect it, but we've also learned to fight it where we can, where we are able to, and where we can save the patient's life. That is what we will do by the grace of God, and also by the knowledge which He has given to us as healthcare workers to help our patients where we can, but to also allow the process or the circle of life, I guess, to just happen where it must, where we cannot do more for the patient.
Thank you. That's beautiful, Shannon.
Thank you, Ronald.
Yeah. And so, Shannon, I was thinking, we were speaking about the third. Is there a third wave coming?
Yeah,
What do you think?
I think if we all work together and if we all apply the rules which has been set out by government, by the Department of Health, we can prevent a third wave from coming. However, if we are going to resort back to our ways that we did under level 4, for example, when the liquor stores were open, the liquor ban was lifted, and people kind of threw caution to the wind, and the masks weren't being worn anymore, and we weren't sanitizing our hands anymore, and our infections kept climbing, then the possibility of a third wave is quite real. We obviously would not want a third wave to happen because it would be a knock for everybody involved. But I think if we could work together as a community, even as a nation at large, we could possibly prevent a third wave from happening.
So earlier on, you were talking about the virus getting stronger every time. And I was just thinking, if you could maybe talk to us a little bit about that.
Sure. So I'm not an expert.
Yes,
the virologists would be able to give more detail, but we are aware that there are new variants of this COVID-19 virus. And technically what it means is that the virus mutates itself. So it kind of grows a sibling, if you could call it that. And you might have developed immunity to the one strain of the virus, but not to the second one. So what we noticed with the second wave of COVID-19 is that it was affecting more of a younger population, even those without comorbidities. Whereas the first one was affecting our more senior population and those with comorbidities. So what we've come to find, unfortunately, is that the virus has, in a way, outsmarted the immune system a little bit by replicating itself into a new variant. However, there are also vaccines that are being developed as quickly as what the virus is replicating. So quick, our scientists and our healthcare providers are trying to make a vaccine to combat that as well.
So there's a belief that, or there's talk going around, and I don't want to spread fake news, but there's talk going around that the vaccine is actually where you are being injected with the coronavirus. Is that true?
So the way vaccinations work, the same with the flu vaccine that we would get every year. You are injected with a variant of the vaccine. So a type of a flu that you could develop immunity against. So with COVID, it is the same. We would not inject our patients with an active COVID-19 virus that would make them sick or have them end up in hospital. But it is part of the system of having your immune system develop a host response against the virus. That is the best way that I could explain it to you.
It's almost like before you go out and drive on the road, maybe you can do a game at home and first drive.
Or take some Pac-Man lessons or some driving lessons at home.
At home on a video game and just know a car needs to drive on the left.
So just learning the rules of the road before placing your vehicle
and so when you go out on the road, then you are just a little bit more equipped.
Yes, and you are safer.
And you are
for those around you, and that is how herd immunity works.
Yes.
So if you and I were to be protected against the virus, if we go home, we have a less chance of giving that virus over to our loved ones, and therefore we prevent spreading the virus if we have herd immunity. And that is, I think, what we are trying to achieve with the vaccination program, is to achieve herd immunity in our communities so that the virus doesn't spread beyond what we can control.
I've actually heard very interesting statistics, a talk that I heard about people in Khayelitsha and in Fish-hoek, where they compared the numbers, the first wave and the second wave. And what they found that the people in Khayelitsha, there were a lot of people that were sick during the first wave as compared to Fish-hoek's people. But with the second wave, it was actually reversed. Is that due to herd immunity?
It is due to herd immunity largely, but it's also due to the community just adhering to the rules and the regulations that have been set out. A lot of people found it, I think, troublesome in the beginning to wash their hands for 20 seconds, to have to wear a mask. It was quite stressful for a lot of people. They became quite anxious, or they felt claustrophobic. But I think once we became used to it, and we would get to the point where we would reprimand one another for not wearing a mask or for not sanitizing our hands if we came into a building. I think that kind of spirit of Ubuntu
of if I protect myself and you protect yourself, we can protect each other. And I think that is why there's been a bit of a change, because we went and did outreach in those communities, and we and the communities actually took the responsibility upon themselves to look after themselves and their loved ones, and especially the elderly and the very, very young, those who can't fend for themselves. The stronger part of the community decided, you know what, we're going to fight this thing. We're going to stand together. We're going to listen to what it is that the Minister of Health and the President and the Corona Council has set out for us. And therefore, we are seeing a drop in infections in some areas, and maybe not a drop in all, but we are hoping that everybody will just give their cooperation and just do their part.
How long do you think we will still have to wear masks? How long do you think we will still have to sanitize? I know you're not an expert, right? But if you had to give an educated guess.
I think washing our hands and sanitizing our hands needs to be there for a very, very long time, because that is part of our basic hygiene. As for the wearing of masks, I think once we've reached herd immunity, I would hope, that would be my hope, that we would be able to see each other just face to face without masks. However, as long as this virus is still traveling via droplet spread and in the air, it's a difficult answer to give, because we cannot say, I mean, we didn't think that a year ago we would still be sitting wearing masks. We thought it would be 5 weeks.
Yes. We thought 21 days and after that we would be back to normal.
Yes.
But
like I said, we would hope that with the new treatment coming out and the new medications that we are finding, and even the vaccine that is on the market, we hope that sooner rather than later we would be able to put the masks down and be able to just hug our loved ones and our friends and our families and to socialize again and to just revert back to a new normal.
And I mean, Renelle, you can also comment on this, that having that physical contact I think it forms such a huge part of healing, and it's a component that's missing now with Corona.
It definitely is.
Right?
Absolutely. Yeah.
So how do you see the future? How do you see, where do you think from in a year's time from here it would be, even if we have to speak out of faith?
So I'll definitely speak out of faith, because I do believe that the Lord has a plan, although we might not know what that plan is and we might not see the entire picture. He knows, and I don't think it should matter who you believe in, as long as you believe. We need to have that something to hold on to. That's something that can give us the comfort that there is a bigger picture. And I would choose to believe that things would be much different a year from now, that we would revert back to a new normal, even if it means we have to sanitize when we come in at the door. I believe that there's always hope. There's always hope, and there's always light. And if it is that the Lord is that light, or that God is that light, then so be it. And if He imparts to us as healthcare providers the wisdom and the knowledge to be able to help those reach that new normal, then we'll do that to the best of our abilities. So I do believe that in a year from now, we might be sitting having this interview without masks, and hopefully that will just have a new normal.
Yeah. So, Eden FM listeners, we are speaking to Shannon Jentsel from Mossel Bay, moving to Oudtshoorn. Sorry, Mom and Dad Jentsel. And she's doing a ComServe here in Oudtshoorn. She's a newly qualified doctor, and she was just speaking on her experience with what she has experienced with COVID and seen. Renelle, any last words before we greet Shannon?
Thank you so much. I think it was such a joy speaking to you and meeting you. Thank you, Shannon. And yes, a good year to everyone.
And so I just want to say thank you to you, Shannon, as well. And I wanna remind the listeners of what she has said. There is always hope. And I think when we have hope and we have faith, then our actions also speak of that. And that might be the key. That might be one of the keys in surviving this coronavirus. So our last song that we are playing out is called Broken Vessels by Hillsongs. It's Shannon's playlist, remember? And don't miss out. Next week we'll talk again. Volgende week nou sit ek en jy en Hans weer koppe bymekaar.
Sien julle dan.
Empty-handed, but not forsaken. I've been set free. I've been set free. Amazing grace, how sweet.